So good evening, friends. I'm being very fortunate to be invited by the Other Song Academy to share my views on homeopathic management of cancer. Now, cancer is a big challenge of the 21st century, especially when you want to treat a cancer patient homeopathically. There are no standard books available that can show you the path of how to cure cancer or how to manage cancer. The basic principle remains the same as we do for any other illness. The basic law of similar remains the same. But there is an extra questions, extra inquiry that one has to do in the cases of cancer. And it all depends on at what stage are you seeing a cancer patient. Is he coming straight from the hospital with a label of diagnosis that I have been diagnosed today with cancer of the tongue and I want to start homeopathy? No. Very few patients come like that, maybe 2 to 5% in my practice. So then, what cases do I see? So the majority, I would say 25 to 30% would come after some surgery or after some chemotherapy or after some radiation or combination of all the three or combination of the two, and that will bring almost 60–70% of cases to us. And then I ask them, why do you want to come for homeopathy? And the answer is that the cancer keeps on coming back. And if homeopathy can stop cancer coming back, we will be very grateful. So that's the major chunk. The third chunk of patient will be terminally ill cancer patients who are being asked to go home and just pass some time till the death comes because they are totally incurable, totally untreatable with allopathic medicine. And some of them will come with you for pain, some of them will come with you for some discharges, some psychological problem, weight loss, lack of appetite. So what we call as a palliative care. Now, we have a department of homeopathy in KEM Hospital, in Ruby Hall Clinic, in Motiwala Homeopathic Hospital, Nashik, as a palliative onco-care department where we work exclusively palliating cancer cases. So this is how the patients come to us. Now, once they come to us, the treatment strategy is totally different in all the three groups that I just mentioned. The first group, as I said, will only receive a constitutional homeopathic medicine and nothing else because their immunity is still very good. There is no suppression of chemotherapy, radiotherapy, or surgery. So here there are two ways. On one hand, you have to use constitutional right medicine that comes and fits the case. And intercurrently, you have to use antipsychotic medicines that were classified by Hahnemann in his book, The Chronic Disease. Now, why the need of antipsychotic medicine? Because many times you treat the patient with constitutional medicine, symptomatically the patient feels much better. But after 3 to 4 months, when you send the patient for investigation, the tumor will expand. The tumor would have increased. And that will be a big disappointment to the treating homeopathic physician as well as the patient. And so how intelligently you use intercurrent remedies, especially antipsychotic remedies, depends on the skill of the homeopaths. And that is why to treat cancer cases, you should at least wait for 5 to 10 years of clinical experience before you start accepting such cases. Unfortunately, young generation that I see today are very overambitious. So whatever case comes in their hand, they start treating, which is bad. This is dangerous, not to be done in cancer patients. The second group of patients that comes to us with lot of suppression, because surgical intervention itself is a very big suppression, followed by chemotherapy, radiation. So the immune system is totally compromised, and the patient is extremely susceptible to catch infection or for recurrence of the same cancer. And here you have to see the general functioning of the body. If the general functioning of the body, if the general parameters, pulse, blood pressure, respiration, electrocardiogram, liver biochemistry, kidney biochemistry, heart biochemistry are not bad, and there are no other diseases, morbid diseases like diabetes, hypertension, thyroid disorder, etc., then again you have some chances to treat these patients with constitutional homeopathic treatment, again with antipsychotic remedy as an intercurrent. But suppose the situation is very bad, there are hardly any constitutional symptoms left, it's all particular symptoms, local symptoms, pathological symptoms, objective symptoms, symptoms which are very incomplete, without any modality, without any concomitants. Here, you should not attempt to give deep acting remedies. Here, you should not make an attempt to give constitutional remedies, because there won't be much PQR in this case. There won't be much characteristic symptoms in this case. And now this requires more skill, because you have to find remedy with few symptoms. And those few symptoms are mostly pathological. So this requires a tremendous knowledge of homeopathic materia medica, of small remedies. It requires a perfect knowledge of cancer disease itself, various kinds of cancer that you are going to tackle. And you should be very good with your pain management, pain remedies, type of pain, characteristic of the pain, and how to use pain concurrently with the rescue medicine, that is the allopathic painkillers like tramadol or Ultracet or opioid derivatives. So patients come with a lot of opium derivatives in this stage. It is the skill of the homeopath which will help them to reduce the dose. Be very careful. There are many homeopaths who present cases of cancer on webinar, seminar, in the textbook of cancer which they write. Believe me, they are not very clear what they are doing with the patient, because patient may be taking many more things along with homeopathy, and in the end they may give a credit to homeopathy, patient improved. But if you properly analyze, they have not done much with the patient, because patient has improved with many other modalities. So it's very important that you assess singularly homeopathy over other modalities, and that can only be done if you use some international protocols while taking the case and while doing the follow-up. That's the best thing to do, because then you can boil down to exactly where homeopathy lies. How many times he has used the painkiller? What was the dose of the painkiller? On which days he never took painkillers? On which days he took the painkiller? All this is very important in this second category where you are doing a pathological prescribing. Now here also, once you remove the symptoms, once you reduce the symptom, the question again comes back, the tumor is growing bigger and bigger. So how are you going to reduce the size of the tumor? That's very important. Because if you don't reduce the size of the tumor, the palliative care is almost useless, because you treat today, tomorrow the tumor becomes much more bigger, and then you are back to square one. So, if you can find a remedy which can control the growth, at the same time control the symptoms, this is the best. Now, this requires 25, 30, 35 years of skill of handling cancer patients. And that is why, again, a big danger if a young doctors are handling such kind of cases. The third variety are near death and almost death. I remember I had a case of a lady about 52 years old with advanced cancer of the cervix. From cervix, it went to uterus, from uterus to pelvis, from pelvis to ovary, from ovary to pelvis to spine, from spine to liver, from liver to lungs and peritoneum. With excessive loss of weight. No appetite, she became dehydrated. She was hypotensive, and she was almost in a state of shock. This was the time when I was consulted, and the relative says, please help her. Now, what can I help her? Everything is so advanced. Everything is beyond my hand. She needs to be hospitalized. She needs to be given IV fluids. She needs to be given Rice tube. The relative said, we don't want to do anything. Let her die on this bed itself. I said, what are the symptoms? He said, last time when she was conscious, which was 2 days back, because now she only murmurs and she is totally semi-conscious. It was burning, burning and burning from the vagina with very offensive discharge, black color discharge coming out. And she wanted a table fan to be blown between her thighs to give her some relief in the burning in the vagina. She has lost weight. She was only bones. I could not see any flesh. Now here lies your talent. What will you do? As I said, patient totally refuses to go to hospital. In this case, I gave sickle core 33 doses. And within 48 hours, she became from semi-conscious to little better conscious, started taking water, sugar water, glucose water, electrol, and the burning reduced. Now this was a big palliation. We all know sickle core, we all know the burning pain of sickle core, we all know sickle core wants fan, we all know sickle core is emaciated. This was a typical case of sickle core. So like that, in death and near deathful situation, homeopathy plays a very big role depending on the skill of a individual homeopathic physician. Homeopaths will fail, but homeopathy will never fail. And that is why you have to go to a very senior physician, senior doctor who have treated and handled thousands of cases of cancer and learn from them the skill, the art, how to manage them. And I think so Other Song has done a very good job of inviting senior people like Dr. Sarkar as one of the main speaker for this Congress on cancer. And I am very happy to be the part of them. And I would also like to guide you all the theory as well as the practical aspect of management of cancer cases using homeopathy. Thank you so much.